Becky Pearson with Pearson Physical Therapy, and we are talking about women's health today. Oftentimes, the topics that we're going to talk about are somewhat embarrassing for women, and it is very important for us to address it. One of the first things that people think about when we talk about women's health is urinary incontinence. And if you're not sure what that is, that's the little leakage that happens when you sneeze or you cough. And most women are way too embarrassed to even visit with their physician about it. I think a lot of times women think that they should just deal with it, and I'm here to tell you, you don't have to just deal with it. There are things that you can do. And one of those things is strengthening the pelvic floor. The pelvic floor is a set of muscles that basically holds everything inside of you in. And since they are a set of muscles, we can strengthen them. And so I just really strongly encourage women to take a look at this. If you're still struggling or you don't feel like you can activate the pelvic floor, that's what we're here for. A lot of times when I mention that to women, they're like, ooh, I don't know that I want to come in and have anybody talk to me about this or deal with this. So let me put your mind at ease that we don't do an internal exam. Typically we do the initial evaluation, and a lot of it is self-reporting of how many times you have leakages, maybe what you're drinking, because believe it or not, there are bladder irritants that can make it worse. And so a lot of it is very much a discussion of your lifestyle and how we can help you with the changes. The other thing that we do is we take you through a set of exercises where you learn how to do a Kegel exercise properly. And again, it's very private, it's in a room, it's just the therapist and yourself. We have had tremendous success with this, from people in their 40s who have had children and now they have lost some control, to women in their 80s and 90s that we've been able to help them manage their incontinence. So don't think just because you're old or you've had a lot of children that you can't be helped by this. Another important area of women's health is pregnancy. Oftentimes when women become pregnant, they get a lot of back pain with pregnancy and pelvic pain. And that is somewhat normal because the body is going through changes, you're rapidly gaining weight and carrying another human. So it's a wonderful thing, but it can be very taxing on your body. And sometimes we are caught because you are pregnant, and so you can't take medications, and there are certain things that you're not allowed to do. The great thing is that physical therapy is wonderful for treatment of back pain and pelvic pain during pregnancy and also after pregnancy. So we can help you manage it with exercises, and there are physical things that we can do like massage and myofascial release that help ease the pain as well. We've had great success with women even all the way up to delivery date, helping them manage their back pain and helping them manage their pelvic stability. So the pelvis does become unstable during pregnancy because we're getting ready to deliver. And so if we can get the muscles strong enough to help stabilize you, then that will allow for more pain relief during your pregnancy. And afterwards, sometimes there's a very difficult delivery, and the pelvis again, has opened up in order for the woman to have the baby, and sometimes it doesn't go back into place like it should. We can help use your muscles to get you back to where you need to be, which provides for significant pain relief. Another topic that often comes up with women's health is breast cancer, women that have to go through a mastectomy. And it can obviously be very devastating. Women have scarring afterwards, oftentimes have limited range of motion of their arm because of the scarring. They many times will have pain in that area, and they think that that's just normal and expected because they've had radiation or they've had the surgery to do the mastectomy. And there's a lot that we can do for that. First and foremost, we can help restore the range of motion of your shoulders so that you're not limited in how you move that arm. So sometimes that requires stretching of the muscles and the fascia and all that soft tissue there. Sometimes it requires us to work on the scar tissue. So if the scar is adhered down, we do help move that scar tissue again. The other things that sometimes can be complications with that are swelling of the arm, often called lymphedema. and we can help with that as well. We do have some wonderful edema wear, we call it, which is a garment that you can wear to help with the swelling. And we can teach you ways to manage that as well on your own. We really like to teach people how to manage their symptoms and not just having you rely on coming to us all the time. It's kind of like that old philosophy, you can give a man a fish and feed him for a day, or you could teach a man to fish and feed him for life. And we feel like if we teach you how to manage these symptoms, we can help you regain your life and get back to what you enjoy doing the most.